Hi everyone, my name is Hossein Mointagavi and I'm one of the co-directors of the Stanford Climate.
Recording in progress.
My main focus has been incorporating sustainability and climate into the medical curriculum at Stanford and also throughout the US in collaboration with the Climate Resources for Health Education Initiative. Thank you again for attending our symposium today and we're excited to have you here. Before we delve into our next session, I would like to also thank the previous session's speakers and moderators for their insightful comments. Dr. Barb Ernie, who is our faculty advisor, along with Dr. Tomoko Katsumoto, and I will be moderating this session. Both Drs. Ernie and Katsumoto are working at Stanford and beyond in climate, health, and equity education. As climate change disproportionately affects marginalized communities, the need to incorporate equity principles into climate and health education is imperative. In order to expedite comprehensive longitudinal medical education, garnering institutional support has never been more urgent. For this session, we have speakers from Harvard, George Washington, and Albert Einstein medical schools who have been actively involved in equity, sustainability, and education efforts. We believe that today's discussion will not only enlighten, but also catalyze a journey toward more equitable, informed, and sustainable approaches to climate, health, and equity education in a medical setting. Also, one thing to note, we will have time after the talks for discussion, so please enter your questions in the Q&A. From Harvard, we have Dr. Gaurav Basu, Natalie Baker, and Hugh Shirley. Dr. Basu is a primary care physician and director of education and policy at the Center for Climate, Health, and Global Environment at Harvard School of Public Health. His work focuses on the intersection of climate change, global health equity, human rights, medical education, and public policy. Dr. Basu has developed and evaluated numerous innovative health equity curricular programs and has received various awards, including the inaugural Equity, Social Justice, and Advocacy Faculty Award at the Harvard Medical School Charles McAbee Faculty Prize in Excellence. Natalie, who was in the Stanford Climate and Health Group as an undergrad, is now a rising third-year medical student at Harvard School of Medicine. Natalie has strived to build a vibrant community of medical student advocates, serving as a medical students for a sustainable future advocacy chair, a 2023 Climate Health Organizing Fellow, and a member of the Massachusetts Medical Society Climate Change Advisory Board. Hugh is a fourth-year medical student at Harvard Medical School. He is interested in the intersection of climate change and global health and pursues that intersection through research, education, and advocacy. Hugh is the student coordinator for Students for Environmental Action and Medicine at Harvard and has been actively involved in multiple international sustainability initiatives.
Wonderful. All right. Thank you for that lovely introduction. So our group is going to talk a little bit about how we worked with Harvard educational administrators to integrate climate and health throughout our curriculum, specifically by leveraging the idea or concept of a curricular theme, and also talk a little bit about how we included a health equity focus throughout. So I'd like to start with our story. So before 2021, there was a course on climate and health that had been developed ad hoc, but not that many students could engage due to scheduling. However, for years, medical students had been cultivating relationships with educational administrators and had set the groundwork in a lot of ways, including by conducting a survey of classmates, which revealed a strong student demand for a more robust climate curriculum. So using this groundwork of relationships, survey data, and leveraging what other schools had been up to, we gave a comprehensive presentation to our pre-clerkship curriculum committee, which gave us a green light to start approaching individual course directors. However, as we kind of got started, we were struck by the amount of change and turnover there was in the curricula year to year. And so we asked, how can we institutionalize this in a way that improves its staying power? And the answer we came up with was to pursue a curricular theme status, which is an institutional commitment to focus longitudinally on a topic throughout the curriculum. And we'll touch a little bit more on what this means later. So as part of this idea of creating a longitudinal theme, a true cornerstone of our curriculum is a pedagogy which is integrated and longitudinal rather than having more discrete lectures or blocks where we convey information. And so this is using the principles of spacing and interleaving, which has great educational benefits. For one, it both enhances student retention through space-based repetition, and also increases ability for students to make connections within and between discrete topics and sessions, and also just kind of teaches a student how to learn and how to think about these concepts in general. However, a huge side benefit to this as well is that it avoids displacing other material. And so there's a much lower barrier to entry for course directors to agree to participate in these integrations. And it's also harder to just cut out entirely if curricular real estate gets tight one year. Next slide, please. So now that we've outlined our pedagogical approach a little bit, just a few notes on how we actually went about approaching each course director and actually getting this work done. So we generally approach each course director about 6 months ahead of time and start with a discussion of shared values. Most course directors would want us to do the literature review or content review on our own and then come back with a proposal of the content that they could adopt. This varied a little bit person by person, but in the end, using this kind of collaborative and personalized approach, we ended up having every course director agree to integrate material, and now we have a longitudinal theme. So now I'll pass it to Hugh.
Yeah, thank you, Natalie. With the formalization of the climate change and health theme, our group felt that it was important to develop a competency-based framework that we could map our integrations onto to ensure that medical students were progressing towards a set of unified goals for the curriculum. So the next 2 slides go through this competency-based framework that was developed in collaboration between students and faculty. The first competency is really about the relationship, the pathophysiological relationship between climate change and disease. The second competency is how to clinically apply our knowledge of the climate crisis to the care of patients. The third competency is about the structural and historical factors that contribute to climate change and really touches on equity and environmental justice issues. Next slide, please. The fourth competency describes the ways that the healthcare system contributes to and is impacted by the climate crisis. And finally, the fifth competency explores the ways that young doctors and health professionals can be advocates in their communities and globally in finding solutions to the climate crisis. Next slide, please. So the next 2 slides lay out a grid of progress that we've made using this framework and using our pedagogical model. In this slide, we see the pre-clerkship courses mapped across time and across the 5 key competency frameworks. So before the clerkship year, students are exposed to some content in Foundations, POM ICS, Essentials 1, and Homeostasis 2, and to some content in the climate change theme in the post-PCE period as well. Next slide, please. This slide shows the progress that we've made over the last 3 years as we've gained a formal recognition in the curriculum as a theme and have furthered our progress in integrating that theme across the curriculum. Our goal isn't necessarily to fill all the white squares with blue squares, but rather to sensibly integrate climate change content into the courses, working with course directors where it makes sense, so that at the end of our work, we hope to create a patchwork that ensures that students learn about all key competency areas in a sensible way across the curriculum. Next slide, please. Next, I wanted to touch on how we integrated health equity into our curriculum. There's a few key courses across the curriculum where health equity plays a central role. The first is in the first course that medical students are exposed to at HMS called Introduction to the Profession. There's a session that Dr. Basu leads that's focused on the role as the physician as an advocate. And we use the climate crisis as a model for how a physician can do that. And so that session aims to give students the fundamental skills to be an advocate. The Essentials 1 and Essentials 2 courses that happen both before the clerkship year and after the clerkship year, respectively, also focus on health equity at their core. Topics in Essentials 1 include environmental justice, global health equity, climate reparations, and redlining. And in the past, we've had guest speakers, including Gina McCarthy and Reverend Mariama White-Hammond, come to teach students about their experience at the intersection of the climate crisis and health equity. In Essentials 2, we focus on the role of community organizations and environmental justice organizations in combating the climate crisis in the Boston community. We've had representatives from Green Roots, which is a local climate justice organization, and representatives from the North American Indian Center of Boston and the Massachusetts Governor's Executive Office of Energy and Environmental Affairs come together to speak about the role that community partnerships have in addressing environmental justice in the Boston community. We're actively engaged in developing an environmental hazards advanced clerkship for students at Boston Children's Hospital that gives sub-interns the opportunity to do home visits, to learn about environmental exposures, and to learn about how pediatricians deal with environmental hazards. Sorry, could you go back one slide, please? Oops. Finally, across the whole pre-clerkship experience, we've integrated environmental justice concepts into many of our organ system-based courses. And we've done that by working with faculty to reimagine the cases that we use in our case-based collaborative learning concept to include environmental justice issues. And we can talk about that more during the Q&A. I'll pass it to Gaurav now to close us out.
Thanks, Hugh and Natalie. So I'll close this up by talking a little bit about the kind of institutional commitments here again. And so this formal curricular theme approach was valuable to us. I know our friends and colleagues at George Washington also have modeled this approach. And so curricular themes was a model that was at HMS previously. It was a response to LCME feedback on integrating longitudinal curriculum. So there were 6 themes before us: health equity, substance use disorder, LGBTQ health. And so we were the 7th that was approved in January of 2023. And the value again here is that we received formal status, which changes the way that we talk to course directors when we approach them for curricular development. It's helped us accelerate our development, provide a more sustained effort and a more kind of long-term approach. It provides a $10,000 faculty stipend. We've also found some funding for student funding. And again, we're kind of anchored in this approach of a longitudinal, integrated, required competency-based approach. And we're now in the middle of doing evaluation work with the Office of Medical Education. So our next steps, what we're working on now is, we wanted to focus in our first year on the pre-clerkship work. We had been doing some clerkship work, but we're kind of digging into that a little bit more now. Neurology and pediatrics have been great partners in that. And we're thinking of the post-clerkship phase as a space in which folks who want to do a deeper dive have the opportunity to do that. So there is an elective on climate and ethics. Like Hugh mentioned, we're doing a clinical environmental hazards clinical rotation, put an application in for that. And we just got approval for a climate change and global health equity course that's done in conjunction with the School of Public Health. And again, we're doing a pretty elaborate evaluation at this time. So just want to say again, this has been really an extraordinary collaboration between faculty and students. These students have been tremendous leaders. I think we've been using the faculty role. The faculty working group has been a valuable piece of this as well, in bringing expertise to complicated science and medicine. But Hugh and Natalie talked about this kind of workshop space we have. It's been a real creative space where we really brainstorm together with course directors, and a real credit to the course directors that they have bought in and that, like Natalie said, each one of them have signed on to incorporate climate curriculum in the pre-clerkship phase. This is our faculty working group. So again, we have the students doing so much work to lead the charge here, and then we pull in the members of the faculty working group to provide expertise as we develop curriculum, and then really workshop that with the expertise of pedagogy and in content and learning objective context from the course director. So lessons learned here is to build good relationships with key stakeholders and opportunities may arise. An integrated approach has allowed us to have better retention in terms of content for students and to build into a very busy curriculum. That student leadership is an important catalyst in both initiation and development of curriculum, but that we want this not to be student dependent, but student inclusive. Faculty are important for institutional knowledge and guidance and advocacy for administrators and depth and breadth of expertise to try to utilize institutional structures, like in our case, curricular themes, to ensure longevity and add legitimacy to our work. And we're trying to track this carefully. So we're trying to map things. We're mapping the curriculum to the competencies and also measuring through surveys, the response from students for each curricular intervention. That's what we have, and we look forward to talking further about this. Thank you.
Thank you to our speakers from Harvard. Our next speaker is Dr. Chase Moon, who's the chief resident for the Social Pediatrics Residency Program at the Children's Hospital at Montefiore in Bronx, New York, affiliated with the Albert Einstein College of Medicine. He's a primary care pediatrician at the Comprehensive Health Care Center, a federally qualified health center in the South Bronx in New York City. Dr. Moon is also chair of the New York State AAP Chapter 3 Committee on Environmental Health and Climate Change, and his work focuses on pediatric environmental education and advocacy in New York State with New York clinicians for climate action and other community partners.
Thanks for that introduction, and thank you everyone for the opportunity to speak to you today about some of the resident education efforts on climate change where I live here in the Bronx in New York City, and some of the lessons I've learned over the past few years. So to start off, I wanted to talk a little bit about the Bronx for those of you who are maybe unfamiliar with the borough. It's one of the 5 boroughs of New York City up here in the north, and it's the only borough of New York City that's not an island. There's almost 1.5 million people who live in the Bronx, of which 49% are low income, 91% are people of color, the majority are Hispanic and Black, with a per capita income of less than $24,000 a year. And as you can see here on this map on the right of environmental justice areas in New York City, almost the entire Bronx borough is considered such an area. I can't show you all the individual indicators right now because of time, but if we take all of the environmental, social, economic, and infrastructure data into one score, such as this newly launched US Climate Vulnerability Index that I encourage you all to check out for your own communities, you can see that the Bronx is really composed of some of the highest vulnerable neighborhoods in New York City and around the country. And I emphasize all of this because this session is, particularly looking at equity. And when we're thinking about how we incorporate concepts like climate justice into our practice, as me as a pediatrician, but any practitioner, when we come to addressing climate change, we have to start off by focusing on how we can help these types of high-risk communities. And when I decided I was going to do a curriculum for residents here at my institution, I knew it needed to include concrete examples of guidance as well as resources that we could offer to our patients and families, so that this wasn't just an academic exercise, but would also help to start working to address these sorts of vulnerabilities and inequities in the community. And just to drive that home, all climate education, no matter where you teach or practice, has to be rooted in concepts of climate justice, which really considers the larger impacts of climate change on low income and communities of color because of the legacy of environmental racism. If we don't emphasize this while we're teaching about the health effects of climate change, we're going to continue to make poor progress on reducing historic health inequities and injustices in the communities that we serve. So at Montefiore, with those principles in mind, I built a 90-minute climate change curriculum for residents who participated in the curriculum in either one of 2 formats, either a traditional lecture-based format presentation or a small group case-based format, with 4 core content areas, which I'm going to go through in the next few slides, broken down into short cases with some time for discussion before we review the same material covered in the lecture session. Residents in pediatrics, family medicine, as well as internal medicine have all participated in this curriculum over 4 sessions that I've completed between February and November of this year. I actually just completed my last session last Friday with the family and internal medicine residents. So this is what my curriculum looks like. It's 2 parts, 6 sections, with an introductory climate health concept section that really considers vulnerable populations before we take a deep dive into extreme heat, respiratory health, adverse and extreme weather events, as well as mental health. And then we finish off with a section on advocacy and communicating about climate change. Each section focuses on anticipatory guidance that providers can give to patients and families, as well as local resources that families can use. And the learning objectives for each concept area are linked to ACGME educational competencies. In the heat section, we discuss the spectrum of heat-related illness and focus on anticipatory guidance on staying cool in the heat. We also discuss how community members can find their local cooling centers and age-appropriate materials to explain the topic to children as well as adolescents. We also discuss state and federal assistance programs such as the Home Energy Assistance Program, HEAP, LI-HEAP, depending on the state or federal program that you're looking at. For respiratory health, we discuss the links between air pollution, climate change, and how to develop management plans for patients on AQI indices. We cover anticipatory guidance on how to speak with families about air quality, as well as how to change their behavior when air quality worsens. We also highlight the different ways that families can access air quality information in New York State, such as through the federal airnow.gov website or app, or through the New York State's own reported forecasts. And then we also discuss resources for how to talk to children about air quality and pollution as well. When we get into extreme weather, we cover the links between climate change and extreme weather events in the Northeast, which for us is really confined to storms with high winds for now, as well as excessive rainfall and flash flooding, as we experienced in New York City in September of this year. We look at the current and also the anticipated flood maps for the Bronx from 2015 going into 2080, 2100, how to interpret them so that we can talk to families about these and so they're aware if they live in a high-risk flood zone and how to prepare for those things. We emphasize disaster preparedness principles and how you prepare for, you write out, and you recover from extreme weather events. And we show trainees how they can sign themselves as well as community members up for community alert systems like Notify NYC, which is the alert system for New York City, and cover resources for children and adolescents on how to cope, especially after extreme weather and disaster events. With the mental health curriculum, we describe emerging evidence between climate change and acute or chronic mental health disorders and discuss emerging concepts like eco-anxiety and solastalgia. We cover mental health anticipatory guidance and management, specifically during extreme heat events, but also foundational management strategies for dealing with climate-related mental health conditions and how patients can cope with those. And residents get to see resources for families created by mental health experts from groups like the Climate Psychiatry or Psychology Alliance, as well as the Climate Mental Health Network, and children's books on climate anxiety designed by psychiatrists themselves, such as Coco's Fire. And then when it comes to advocacy, we also get to spend some time talking about current policy efforts within New York State and the city, and have had the opportunity to engage in the state capitol in Albany on these and with legislative offices in the Bronx as well. Here you can see pictures of trainees that I was able to take to Albany in 2023 in March of this year to advocate on climate legislation. But we've also done general environmental health advocacy as well as Zoom visits with legislative aides in the state legislature. And 2023 was actually the best year for New York in terms of climate legislation since 2019. We had 3 climate bills that were passed. And the reason I said this was better than 2019 is that's when we had our net zero law passed in New York, which really aims to reduce New York State emissions by 85% below 1990 levels by 2050. Not only have I been implementing the curriculum, I've also been evaluating it to make sure that it's effective. As you know, Carly and Harleen said during their previous session, there's not a lot of data out there showing how much trainees and residents specifically understand about climate change, but also their confidence in delivering these sorts of guidance to patients and families. So I've been able to do a pre and post survey with my sessions. And thanks to an institutional grant from the AMA Reimagining Residency Program, I've been able to offer $20 Amazon gift cards to residents, which have really helped in terms of getting survey participation And then, so as you can see all the questions here, it's a 5-question Likert scale. And the first 2 questions really aim to evaluate resident understanding of the health impacts of climate change, as well as impacts on healthcare delivery. The last 3 questions are about discussing climate change with patients and families, resident confidence in providing anticipatory guidance on climate change topics, as well as confidence in providing or connecting patients with resources and groups in their communities. So these are some of the preliminary results. It doesn't include my last session that I just did last Friday. And here on the graph on the left, you can see that 58 residents have completed the pre and post surveys. What the bars correspond to are those who somewhat or totally agree with each question. And as you can see, all after each session, the majority of residents felt that they had better understandings of climate change and felt more confident in terms of talking to patients about climate change, providing guidance and resources as well. And then the chart on the right, I'm not going to go through too much, but we found that this was statistically significant learning, and there was no difference either between the lecture or the small group learning formats. So leave you with some takeaways for implementing climate change curriculum in residency programs across the country. Climate change is a large, complex, and nuanced topic. It's very difficult to cover, especially in a busy residency training program. But by breaking it down into specific topics and focusing on local concerns, as well as guidance and resources, educators can make it more manageable, relatable, and applicable to practice, especially for trainees who are looking to incorporate these things into their budding practice. Teaching climate change concepts requires preparation and a lot of practice, but important material can be covered in residency in 90 minutes or less. But creativity and flexibility is really essential for this. In residency programs, when we're talking about introducing this type of curriculum, you have to, these conversations are happening with chief residents like myself, with program directors, may even include vice chairs of educations or department chairs. And in my experience, by bringing the facts about the dangers of our communities from climate change, as well as plans and preparing lectures ahead of time, it helps convince administrators of the importance as well as relevance of including this into training program curricula. The more you bring to the table when you're having these conversations, the more likely you're going to succeed. And then when we're thinking about sustainability, it's important to remain flexible and grow or shrink the content that to the time you can get. I originally asked for 6 one-hour sessions for my curriculum, which was never going to happen. And I got 90 minutes and I reevaluated and reformatted. And going forward, I've done this in a few different models, an academic half day for the pediatric residents, a grand round style for family and internal medicine. But going forward, these are going to be incorporated more into orientation and immersion curriculum sessions so that all trainees really get the curriculum towards the beginning of their training so they can incorporate it. But then it's also longitudinal with advocacy events and action alerts with letters, op-ed writing throughout the rest of the year so residents can engage when they have the bandwidth. But sustainability is going to really look different in every training program. For you, maybe it's better in a general outpatient curriculum, or for others, maybe it's a simulation setting, a simulation session on heat illness or drownings. I also personally really think that a strong climate change or environmental health advocacy component to the curriculum is essential, but it might be less realistic for states or programs who live in more conservative areas that have more conservative views on government or policy. So with that, I will stop. Looking forward to the Q&A session. Thank you very much.
Thank you, Dr. Moon. Our next speakers are Dr. Nuala Tumala and Savita Padaruzu. Dr. Tumala is an ENT physician and assistant professor of surgery at George Washington University School of Medicine and Health Sciences. Dr. Tumala is also co-director of the Climate Health Institute at George Washington University and is on the executive committee for the Medical Society Consortium of Climate and Health. She's an avid writer on the intersection of climate change, health equity, and climate policy. Savita is a fourth-year medical student at George Washington University School of Medicine and Health Sciences, applying into OBGYN, and is on the current executive chair of medical students for sustainable futures. Savita also co-led the development of the climate change and human health fourth-year curriculum theme at George Washington.
Great, thank you so much. Well, we're really excited to be here and to join in this conversation about climate change and how we're incorporating this really incredibly important topic into the education curriculum at George Washington University. And I'm joined today by Savita, one of our fourth-year medical students. So when I first started at GW, which was 5 years ago, there were a few people who were already thinking about climate change and thinking about how we can incorporate this into the curriculum. And, at that time, the way that climate change was being incorporated was as very focused lecture. So it's usually for the preclinical students or the first and second year medical students. And it was lectures that ranged anywhere from 2 to 4 hours as very focused lectures on climate change, on environmental risks. And it was sort of, in those 2 to 4 hours trying to cover everything that we could. And when I say it included 1 to 3 interested faculty members, I feel like each year I was here, there was another faculty member that was very interested in this topic, and we were able to grow our numbers slowly. But again, it was a little bit of a slow rollout out starting. The pros of this approach was that it was very straightforward to implement, right? It's a lot easier to plan a focused lecture at one point in time versus an integrated lecture, which is what we're trying to do now. And it allows an introduction to the topic. The downside is that it is a very clustered type lecture, which means that you hear about it once and then you sort of move on, and it doesn't allow you to get into as much depth as you would want to for future healthcare providers. So I'm going to hand it over to Savita as we talk about the GW journey.
Thank you, Dr. Tamala. And it was so wonderful. Dr. Tamala and I were reflecting on how far we have come. When I was a first-year medical student, we had a phone call about me wanting to, help lead this more longitudinal approach. And Dr. Tamala was like, that's a big effort. And I was like, I know, but can we try to do it anyway? And here we are 4 years later. I'm so happy to talk about how far we've come. It started with the needs assessment that we conducted kind of at the end of my first year medical school in the summer of 2020 after COVID hit, where we used the planetary health report card in addition to a more in-depth needs assessment of our learning objectives in the preclinical curriculum specifically. And then later that fall, we used some of the gaps that we found, which were basically that, a handful of learning objectives mentioned the word environmental in them, but really didn't, allude to the impacts of climate change on health and kind of where we wanted to take this. And so we took those identified gaps and came up with a proposal to, for this long-term 4-year curriculum theme that was based on competencies. And so we mapped those out, we meaning, a team of students and our mentors, so that we could put this theme together and bring that to a variety of preclinical and themes committee meetings. And something that you'll probably start to draw parallels with is the approach that our colleagues at Harvard did, which is this theme approach, which helps kind of infuse the content we already learn with a climate lens. And so throughout, spring of 2021, all the way to fall of 22, after a series of these meetings, getting feedback from our deans and faculty about how they think we could best integrate this, we were able to take all of these refined pieces of feedback, form a final proposal to the overarching MD program committee called QMEC. So in February of this year, just a month after Harvard, we were able to approve our 4-year curriculum theme in climate change and health. And all of our roadmaps and learning objectives were adapted from this publicly available resources, Climate Resources for Health Education, which we've been referring to. So I just wanted to contextualize that a little bit. And these are examples of how we adapted the learning objectives from CRHE to how our GW MD program is structured. So the left column under course objective is something that already exists, and we, if at all, we tweak it by adding the word environmental in there so that in the next column, when we propose session-related objectives relating to climate change and health, also adapted from CRHE, we're able to map them out more at a granular level. And we provide our supporting evidence and then proposed methods of evaluation. So this is an example in our Foundations of Medicine block. In the next slide, I'll talk about how we did this in the cardiology block. Next slide, please. Yeah, so this again is meant to demonstrate how in each of the organ system blocks specifically, our attention to detail and wanting to roll this out, and also just apply that climate lens, not introducing an entire new lecture or clustered lectures, but really kind of repurposing what we already learn with new evidence and peer-reviewed learning objectives. Next slide, please. And another way that we are promoting climate justice in our curriculum, which is also kind of a defining feature of our education at GW, is that we have a clinical public health course called Patients, Populations, and Systems, PPS. And that course in itself has its own course objectives, session objectives, et cetera, and pretty much allowed for a kind of seamless integration of climate justice as we talk about other justice and equity issues in the course. And so whenever we had an existing course objective that says describe the social, sociocultural, environmental, et cetera, and determinants of health, we were able to very easily propose session objectives relating to climate change and health, again, with its supporting evidence and methods of evaluation. Next. So the overall theme objectives, as you can see here, were to demonstrate this knowledge at the individual level, at the population level about the health impacts of climate change. Two, to recognize that climate change is associated with disparities in health equity. Three, apply this knowledge to our counseling and our patient care and clinical decision making. Four, recognizing how this issue operates at the level of the health system as well in terms of sustainability and what that means for our day-to-day work. And lastly, integrating kind of the ethical component of this with environmental bioethics and what that means for both our individual patients and communities. This is our implementation plan, kind of giving you an overview of the different courses that our curriculum has. So we have our organ system blocks like many other institutions, practice of medicine, patients, populations, and systems, and then our clerkships. And so we started more at the preclinical level and are working specifically on the organ system blocks right now, as well as PPS. Plan to work on practice of medicine and the clerkships right after that. And then I'll pass it on to Dr. Tamala to wrap it up.
Thanks, Savita. So I'm going to go over some of the key takeaways that we had when we were talking to the curriculum committee. And so when we talk about how we started to, getting the approval for the integrated curriculum this past spring, a lot of that was contingent on us also having a champion within the curriculum committee. And I think this is something we've heard from other institutions as well. It's like really someone who's able to push these efforts forward. That being said, we still had an entire curriculum committee to convince to say this is something that's really important. And so some of the things that we really focused on when talking to them is that our goal here is to apply a climate lens to existing material. One of the concerns is, talking about all this new material that would need to be developed and the demands of that and who was going to do that. And so what we were really trying to show is that it's not necessarily that we need to redesign every lecture or redesign all the curriculums that we already have in place, but to apply a climate lens to that. And then also using the existing resources like we just showed to ease some of the logistical concerns of how are we going to apply that climate lens, but actually saying there are resources already available to all of us that a lot of medical schools are utilizing and that are fantastic resources for doing so. Of course, leveraging the available faculty expertise. And so what we realized is that there were already a good number of faculty members who are working on this in various ways. And so again, using their past experiences and to influence how we would integrate this topic into the curriculum. And then we needed a lot of buy-in from students, administrators, deans, and faculty. So, Savita and her colleagues really led the efforts for approaching the curriculum committee and getting this integrated. And we need champions on the curriculum committee team. We needed faculty advisors to be involved with this. And so it really is a very interdisciplinary effort to be able to advance this agenda forward. And continues to require a lot of collaboration because this isn't just sort of like a one-time thing. This is a very long-term project that requires a lot of energy and effort to move forward. So we've learned a lot of lessons and we're continuing to learn lessons as we go along. And so, personally, I think that the curriculum integration approval is just the beginning of sort of this journey of us training a new cohort of healthcare professionals. As I already mentioned, students really were incredibly important in mobilizing support. I was very impressed by how much Savita and Taylor and other students did in terms of moving this forward, and how much the curriculum committee, really listened to the concerns of the students and wanted to do this because they were so interested in it. I said need education for every person involved with an integrated curriculum because what I learned early on in some of our meetings is everyone on the curriculum committee, one, may not have approved it, or two, really understand this topic. And so what we realized is we kind of just started jumping in and talking about environmental justice and talking about integrating, heat extremes and thinking about all of these different topics that we all know. We're all very familiar with this language because we care a lot about environmental inequities and talk a lot about it, but not everyone who's on the curriculum committee understands that. And so one of the first questions after, it was like 45 minutes into the meeting, someone was like, what is environmental justice? And I realized that we actually had to take a step back and provide a little bit more of an introduction into this topic. From a faculty perspective, definitely need to really be aggressive about advocating for protected time for faculty. This is not a small project. This is, if done well, it does require a lot of energy and effort from the faculty. And so you really want to push forward for that from the beginning. So need to make the case for why a climate curriculum specifically is needed. Again, this was one of the concerns was, why can't we just take what we have and just like sort of alter it a little bit versus like really applying a strong climate lens to everything. And so we used a lot of data to be able to show why is it so important to have specifically this climate information within the curriculum and not just sort of talking about it as we go along. Highlight the available resources. So again, one of the major concerns from the curriculum committee is who's going to do all this work. And so that's why we need faculty support, but then also highlighting that there are available resources to get the ball rolling. And I think that's really helpful to have those out there. And again, what I'm learning is also it's okay to start slow. I think we were all really excited in the spring when it got approved, and it's been a slow rollout and I think it's going to continue to be over the next, the way I think about it is like 1 to 3 years. Each year we make more and more progress with each year of the curriculum, but it is progress and it's moving forward, but it's not just because things get approved, everything's going to happen. And so sort of slowly moving forward and making the curriculum changes in the appropriate way. So that's our part. Thank you.
Thank you again to our speakers for your insightful presentations. We will now ask some questions from our panelists.
Thank you, Hossein, and thank you to all of our speakers. There was so much great information shared, and we'd really like to take some time now to ask some questions and have some discussions. We did have a question in the chat from Dr. Bob Gould, who's been our PSR president many times. A few years ago, 2019, actually, the AMA declared that climate change must be taught across all aspects of medical education, and they promised to make a prototype presentation and lecture notes available for all levels of education. I know we're all using the Climate Resources for Health Education from the Global Consortium on Climate Change and Health Education. Have any of you found anything from the AMA or any other resources?
I can take that question because I know I definitely spoke about the AMA a little bit during my presentation. So I'm mainly engaged in pediatric societies with like the AAP and Pediatric Academic Society. So I'm not completely sure what the AMA is doing, but I did get a grant from the AMA Reimagining Residency Initiative, which is really geared towards novel curriculum or other initiatives in residency programs for which my climate change curriculum counts. But those grants go to any sort of initiative, not specifically just climate change or environmental health. I was quickly Googling when I saw the question, and it looks like there's some AMA collaboration with like the American Board of Pediatrics, but I didn't see any prototype presentations or notes. I worked a little bit with the CRHE initiative and making some of those slide decks, but I thought they were a little too general for what I wanted to do for the pediatric residents in the Bronx. So a lot of what I've done is just, doing the slog of literature review and building it myself.
Thank you, Chase. As far as building the curriculum in the pre-graduate education through the preclinical courses and clerkships, had the rest of you really depended quite a bit on the CRHE materials? Savita and Natalie, Hugh.
Yes, a lot of our suggestions that we propose in our roadmaps and our curricular approach were definitely adapted from CRHE. And interestingly, that resource was growing around the time that we were proposing this. So we are, we're growing together. So the more research that comes out from them, the more we're able to also integrate without reinventing the wheel.
Thank you. And we're also, Gaurav and Dr. Tumala, we're interested, how did you get, do you have protected time to be working on this? Are you the only faculty that specifically is getting protected time or any kind of reimbursement for working on these projects, and how were you able to obtain that?
So we're at an interesting transition right now because the person who was going to be the faculty lead is actually leaving GW. And so right now we're transitioning into figuring out who the next leader will be. But she was offered 0.05 FTE. So not, in my opinion, not nearly enough support or time to be able to really work on this, but was offered some.
Yeah, that's about the same 0.05 for each of the themes at HMS. There's a faculty director, so that stipend becomes available with the theme categorization. Barbara, I think you're on mute.
Chase, were you given any protective time or support in your residency program?
That's a great question. So for me, this was really a research project. So I have protected research time where I was able to do a lot of this. Now as a chief resident, as part of my research, and I'm planning on doing it going forward in fellowship. But I'm having those conversations about FTE right now.
Thank you. And, we were talking about equity and advocacy. I know it's tough for us to get anything about really advocacy into preclinical courses, as basic science especially. At what point do you start introducing advocacy into the pre-graduate medical education, and then certainly in residency, the patient advocates, and Chase so nicely showed how doctors can be patient and community advocates. But before residency, have you been able to get anything in about advocacy into your curricula?
I'll maybe start us off. I mean, a nice thing is, on the third day of med school, we like George Washington, kind of go along the existing curriculum and try to integrate into what it is. So we want to support the kind of existing learning objectives of every course. I'll give a credit to HMS's curriculum that there's actually a fair amount of space in the first pre-clerkship year where students are thinking it's a med school competency for the overall curriculum to be thinking about systems thinking and advocacy. So on the third day of med school, we do there's a session on physician advocacy, and climate has been the topic for the last 3 years. And then we have a social, like Hugh had presented, a social medicine course in the pre-clerkship, and then one post-clerkship as well. So that's where we really dig in. You know, we really talk about issues of like global climate reparations and what it should mean to advocate at the UN and things like that. I was impressed with Dr. Moon's, you know, active advocacy and really getting folks to, you know, to the State House and being a part of policy. Those social medicine courses also teach kind of legislative advocacy workshops. So we try to kind of meld it together so that people are thinking about their interests of what they wanted to, what they would want to advocate during those workshops and consider climate and environmental justice.
Great. Now we're getting lots of great questions in the chat, and we only have a minute left, but I did want to put in a reminder from Dr. Chen that voting is a social determinant of health, and just using the Vote ER badge or just encouraging patients to register to vote or go out and vote, no partisan anything, but voting, just helping your patients get registered to vote, certainly a big way to help with advocacy. And I think we're just running out of time here. If any of you have a chance in the chat to type an answer in for the folks that are asking some questions, that would be great. But we've got a lot of work to do and to go. But today I've just seen such great organization on how you've approached this in such a systematic way and how you're getting the work done that we really appreciate it. So thank you all for participating in this session, and all of the audience for listening in and having such great questions. Sounds like we've got a lot of interest here. So thank you all very much.
Thank you.
And I think we're going to break now, I believe. So thank you.